Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Today, in this International Conference of Community Services, I would like to share my community services activity with the title Socialization and Education on the Effect of Malocclusion toward Dental and Oral Health. This is conducted by me, Tita, Ratya, Utari, and also my colleague Parstoken Mawanto, and my student Anissa Fadilasari. This is also collaborate with my student at KKN 001 Grogol, Sayegan. Malocclusion is a condition where the occlusion is abnormal. Occlusion is considered normal if the position of the teeth in the dental arch is arranged properly and correctly, and there is a harmonious relationship between the teeth of the upper jaw and lower jaw. The incidence rates of malocclusion worldwide reach 56%, and in the ASEAN reach 48% in children and adolescents. The incidence rates of malocclusion in Indonesia reach 80%, while only 0.7% of the population undergo orthodontic treatment. The impact of malocclusion can cause problems such as a periodontal disease, dysfunction in the mastication process, speech dysfunction, including problem when moving the jaw, and temporomandibular dysfunction, as well as affecting the risk of caries or cavity because crowded teeth are more difficult to clean. Therefore, it's very important to provide outreach and education regarding malocclusion. This community services activity will carry out at SMP Muhammadiyah 1 Sayegan. The method of this activity is the first we are given the 15 questions to students before and after as a pre and post test, and then continue with counseling regarding the meaning of malocclusion and malposition that can be occur in the dentition, as well as side effect or consequence that can be occurred in the oral cavity if the dentition in the malocclusion and malposition condition. After that, we are training to brush teeth properly and correctly. We are demonstrate how to brush the teeth properly and correctly, and the student follow and they practice how to brush teeth correctly. The result of the pre-test and post-test will analyze, and the result of statistical test using the t-test showed that there was significant difference before and after socialization and education on the effect of malocclusion on dental and oral health in 54 students of SMP Muhammadiyah Segan. We can see in the chart. This result indicates that the students have a better understanding of the importance of recognizing malocclusion and knowing the detrimental effect on dental and oral health due to teeth with malocclusion, as well as the importance of maintaining the cleanliness and health of the teeth and mouth. Socialization and education in this community services activity using the audiovisual method, using interesting PPT and videos, where the advantage of audiovisual include being able to create a more lively atmosphere, a more beautiful presentation, and a more accurate depiction of the reality of an object or a particular procedure, and also easier to accept so that it can be quickly and easily remembered. This also supports research conducted by Purwono and Johnny that audiovisual media has succeeded in improving learning outcome and student absorption capacity. So as a conclusion, socialization and education on the effect of malocclusion on dental and oral health effectively increasing the knowledge of students at SMP Muhammadiyah 1 Sayegan. It's a hope that this result will increase motivation to maintain oral hygiene and health, especially for students with malocclusion. Apart from that, it's hope that it will increase the awareness of students, especially for students with malocclusion, to undergo orthodontic treatment. Because teeth with malocclusion can have an adverse effect on dental and oral health. Follow-up is needed with screening so that malocclusion abnormalities can be better detected. Thank you very much for your kind attention. Wassalamualaikum warahmatullahi wabarakatuh.